Gallbladder and bile duct cancers. Gallbladder and bile duct cancers, also known as cholangiocarcinoma or biliary cancers, are relatively uncommon. These cancers manifest in different forms, each named based on their origin. Intrahepatic bile duct cancer initiates in the ducts inside the liver, while extrahepatic bile duct cancer starts in the ducts outside the liver. Gallbladder cancer begins in the walls of the gallbladder. Let's learn. Intrahepatic cholangiocarcinomas, starting from tiny ducts inside the liver. Known for their adaptability and potential to grow into large tumors before detection. This makes early detection crucial, as symptoms may not manifest until the cancer has progressed significantly. Risk factors. Gallstones. Persistent presence of gallstones can increase the risk of gallbladder cancer. These are solid particles that form in the gallbladder. Primary sclerosing cholangitis, PSC, an autoimmune disease causing inflammation of the bile ducts, elevating the risk of cholangiocarcinoma. PSC is a chronic condition that damages the bile ducts. Choledochal cysts. Congenital conditions involving cysts in the bile ducts may increase the risk. These cysts are present at birth and can affect bile flow. Chronic bile duct infections and inflammation. Prolonged inflammation and infections can contribute to cancer development. Inflammation in the bile ducts over time may lead to cancer. Age and gender. Incidence increases with age, and women are more prone to gallbladder cancer. It is more common in individuals over 70 years of age. Ethnicity. Certain populations may have a higher predisposition to bile duct cancers. For example, Native Americans have a higher incidence. Liver fluke infection. In regions where liver flukes are prevalent, there's an elevated risk of bile duct cancer. Ingesting raw or undercooked fish containing fluke larvae can lead to infection. Family history. A family history of these cancers may increase individual susceptibility. If close relatives have had bile duct or gallbladder cancer, there might be a genetic component. Stay informed about potential risk factors such as age, geographical location, and underlying conditions. Regular health checkups and lifestyle adjustments can contribute to early detection and prevention. Prevention. Healthy diet. A balanced diet rich in fruits, vegetables, and whole grains. It's essential to minimize the intake of processed foods and saturated fats. Maintaining a healthy weight. Obesity is linked to an increased risk of gallbladder cancer. Regular exercise and a balanced diet can help in weight management. Regular exercise. Physical activity supports overall health and may reduce cancer risk. Aim for at least 150 minutes of moderate intensity exercise per week. Limiting alcohol consumption. Excessive alcohol intake is associated with an increased risk. Moderation is key to minimizing this risk. Treating and managing gallstones. Seek medical attention for gallstone-related issues. Prompt treatment of gallstones can reduce the risk of associated cancers. Embrace a health-conscious lifestyle. Incorporating balanced nutrition, regular exercise, and routine checkups to minimize the risk of bile duct cancer. Symptoms. Abdominal pain, particularly in the upper right side. Persistent or severe pain should be evaluated. Jaundice, yellowing of the skin and eyes. This may indicate bile duct obstruction. Unexplained weight loss, significant weight loss without apparent cause. Sudden and unexplained weight loss should be investigated. Changes in bowel habits, such as light-colored stools. Changes in bowel habits, especially if persistent, should be addressed. Nausea and vomiting, especially after meals. Persistent nausea and vomiting may be indicative of bile duct issues. Abdominal bloating. Feeling full or bloated after eating small amounts. Unexplained abdominal bloating should be evaluated. Don't hesitate to prioritize your well-being and seek guidance when needed. Diagnosis. Imaging studies, CT scans, MRIs, and ultrasounds help visualize the structures. These imaging techniques provide detailed information about the gallbladder and bile ducts. Blood tests, liver function tests and tumor marker tests may provide relevant information. Abnormalities in liver function tests may indicate bile duct issues. Biopsy. Tissue samples may be obtained for laboratory analysis to confirm cancer. This involves extracting a small sample of tissue for microscopic examination. Endoscopic procedures. Endoscopic retrograde cholangiopancreatography, ERCP, and endoscopic ultrasound, EUS, can aid in diagnosis. These procedures involve using a flexible tube with a camera to examine the bile ducts. Exploratory surgery. In some cases, surgery may be necessary for a definitive diagnosis. Surgical exploration may be required to visually inspect and obtain samples. Regular checkups and screenings can significantly contribute to early detection and improved outcomes. Treatment approaches. Surgery. Complex surgical procedures are common. Specialized techniques, learned from extensive experience, are applied to reconstruct blood vessels and bile ducts. Chemotherapy and radiation. Crucial in treating these cancers, chemotherapy may be administered before or after surgery. Genomic sequencing is performed to target specific genetic mutations, enhancing treatment efficacy. Radiation is employed when surgical removal is challenging. Transplantation. In cases where surgical removal isn't possible, transplantation is considered, especially for hilar cholangiocarcinoma. Mount Sinai prioritizes such patients on the transplant waiting list, offering a unique treatment approach. Gallbladder cancer incidence. Gallbladder cancer is more prevalent in certain regions, with higher rates reported in parts of South America, Asia, and Eastern Europe. India has one of the highest incidences globally, attributed to factors like gallstones and genetic predisposition. Bile duct cancer incidence. Regions with a higher prevalence include Southeast Asia, where liver fluke infections contribute to the increased risk. The incidence of bile duct cancers, also known as cholangiocarcinoma, varies geographically. Challenges and considerations. Both gallbladder and bile duct cancers are often diagnosed at advanced stages, impacting overall survival rates. Limited awareness, nonspecific symptoms, and challenges in early detection contribute to delayed diagnosis. If you have specific dietary concerns or restrictions, consulting with a healthcare professional or dietitian is recommended. Please note, the information provided in this video is for general informational purposes only. Thank you for watching. See you in the next episode.